Good morning, good afternoon, good evening. My name's Ton. I'm here today to talk about faster, easier check-in with an iPad at the portable device. Project overview, the obstacle of the current triage, the background of the triage quality improvement, model of improvement, management skill for the QI project, the value, contact, and the management tool of the QI project, the quality improvement process, basic step of the QI project. The obstacle of the current triage. An urgent care clinic usually sees a large number of the patient each day, and each patient must go through the several steps before seeing the provider. When patients arrive, they first complete the registration at the front desk. After submit on the paperwork, their insurance is verified. If there are no issues, the front clerk reviews the document and updates the patient status to ready. At that point, the back office medical assistant call the patient, escort them to the vital sign room to begin the triage process. During the triage, the MA records the patient trip complaint, vital sign, and any drug allergies. Once the triage is complete, the MA moves the patient again, this time into the exam room. This workflow can become time-consuming. If the first patient takes longer to move through the process, the delay affects the next patient, creating the domino effect that increases the overall wait time. Several studies have examined the patient tolerance for the wait times in the medical office. One study found that 62.7% of American patients believe wait time is the most wait time consuming parts of the seeing the doctor. Among patients aged 35 to 44, many report feeling frustrated after waiting just 15 minutes. When wait time becomes longer, 46% of the patients are willing to leave the clinic together. Third, prolonged wait time can significantly affect not only clinic overall performance but also patient satisfaction. Now, look at the chart. You see the cause and effect diagram of long-term wait. First factor is pupil. The patient experienced long wait time in the lobby and the triage process. The MA need time to complete triage because the sign in and out of the computer. Second factor is the policy. Administration is the goal is to reduce the triage time so that the patient can see the provider more quickly. That's their goal, but it's hard to establish at the moment. Resource. The MA are forced to share a single computer in the vital sign room. The workflow is the last factor. The current process involves the patient being confirmed from the front lobby to the vital sign room where the MA performs the triage. Patient move to the exam room. This workflow requires the patient move between the two different rooms. As a result, the long patient wait time are inefficient triage. Now, how do we improve the current triage better? That's it, the iPad. Let's go background of the triage quality improvement with an iPad. The iPad is the portable device that offers many benefits. Two of the most important advantages of the triage are the enhancing the workflow and improve the process to electronic medical records. Medical assistants can easily carry the lightweight iPad, allow them to move quickly through the clinics. The iPad also provides fast access to the EMR, since the MA already logged into the system. Just few taps and need to open the patient chart. As a result, an iPad enables MA to access the patient information from anywhere in the clinic, improve the efficiency, and support the smoother workflow. Now, the main part we want to talk is how do we do the quality improvement. The model of improvement for an iPad QI. The model improvement allows the quality improvement project to develop in a structured and organized way. The project is guided by the three key questions. What I'm trying to accomplish? How will I know that the change is an improvement? What the change can make that will the result in the improvement? The plan do study arc cycle is then used to apply the iPad QI project in the real-world situation, demonstrate how the proposed change can be tested, evaluated, and refined for the effective implementation. You can see all of that in the figure 1. So let's do the first question. What I'm trying to accomplish. To answer this, the SMART criteria have defined the aim statement of the implementation project to 5 components. First, specific. The main goal is to improve the triage process in urgent care by using an iPad. Second, measurable. The key metric is the duration of the triage measured from when the patient is called from the lobby to the complete the process. Attainable. The target is reduced the average triage time from 5 minutes to 9 minutes to 5 minutes. Relevant. Shorten triage time improving workflow efficiency and allow provider to see patient more quickly. Time bound. The project will be organized, implemented, and evaluated within 3 months. Therefore, SMART framework chart an aim statement as follows. The medical assistant will be equipped with an iPad to improve the workload efficiency by reducing the triage time from 9 minutes to 5 minutes within 3 months after implementing the new portable device. Second question, how will I know that change is an improvement? To answer this question, they divide become 3 parts. Part A, domains of the value to identify the measure for the improvement. Part B, operational definition of the measure. Part C, the management tool of the QI project. Part A, domains of the value identify measurement for the improvement. So we already talked about the aim. So now we focus about the quality. The first, clinical outcome and the result. First, the total number of the patient who check per day, the time they require to move the patient from front desk to the exam room with the triage complete, the average patient wait time. Second part, the function status of the patient or the exam. The total number iPads is equipped for the MA, satisfaction of the stakeholder, patient satisfaction with the wait time and overall the workflow, staff satisfaction with using the iPad perceived workflow efficiency. The second factor, cost. Clinic cost when the patient leave without being seen due to the long wait time. Second, cost purchasing the iPad. The last factor, the social determinant of health. The percentage of the patient with medical, Medicare, and the commercial insurance, the percentage of the patient without the insurance who attend the clinics. Part B, operational definition for the measure. Daily patient volume is the total number of the patients who check in at the urgent care clinic each day. Second definition, triage completion time, the average amount of time in the minute required to move the patient from front desk check-in to the placement in the exam room with the triage complete. The third definition, average of patient in the waiting time, the average time patient spending waiting measured from check-in until the wait-in in the exam room. Total number of iPad, the amount of iPad is used by the MA to do the triage. The patient's satisfaction with the wait time and overall workflow. The survey about the wait time and workflow is sent to the patient after their visit. The survey is used to evaluate patient satisfaction. Staff satisfaction with using the iPad perceive the workflow efficiency. The staff receive the survey about the workflow at the end of each month for 3 months to evaluate effectiveness of the iPad implementation. Clinic costs when the patient leave without seeing due to the long wait time. The amount of money clinic lose when patient leave due to long wait time based on potential visit billing. This is the most important definition. Cost of purchasing iPad, the total amount of spending the purchase of an iPad. Now, back C, the management tool of the QI project. The statistical process control chart developed from Blanchard is a powerful tool detecting special cause variation beyond normal random fluctuation. It identifies process shifts such as 7 consecutive points on one side of median, trend of move, then 5 point beyond upper or lower control limit, and other specific patterns. These rules make the statistical process control chart highly effective to recognize significant change in the process. The SPC chart can evaluate whether using an iPad for the chart can improve efficiency. Rather than rely on the single observation, the chart checks the performance over time. Shift of the 7 consecutive points below the mean or 15 points within one standard deviation below the median would provide strong evidence of the sustained improvement in the triage time. So table 1 demonstrates the triage time plot. That is how the MA document the time of the patient. This is the example when you finish the SBC chart and how do they look. So you will see the average of the patient waiting, the upper lower control limit. So if at the beginning from the day 1 to day 14, if you're not implementation yet, you see the average time patient is higher. After implementation, the average around 7 point consecutive point around 6 minutes. So that means demonstrate the implementation improve and reduce of the waiting time. So the last question, what change can I make that will the result in the improvement? If the triage use the positive the result, the clinic will proceed to adopt the iPad implementation. The process will be guided by the land-do study arc cycle. Plan, establish the object of the test, and specify the setting and timeline for the implementation. Do, execute the process while the document step taken, study, analyze the outcome of the test, and evaluate the finding. Act, determine the implement appropriate action based on the result. Basic step of the QI project. Plan week 1 from to 4. The clinic starts to prepare the budget for the 2 iPads and set up the QI team. The system leader is the medical director. CEO will be responsible for review and formal approve this quality improvement project. Day-to-day leader is the office managers at each clinic will oversee the staff performance and ensure the protocol is implemented consistent and accuracy. Facilitator is me. I will serve as the facilitator, accommodating implementation across the clinic, provide guidance, encourage adherence a new guideline, and address the staff question or concern as they arise. Team leader, the lead medical assistant will be accountable for ensure that on MA follow protocol that is triage time and document with accuracy, and that reporting remain free from the bias of fraudulent entries. Basic step of the QI project. Do from week 5 to 10. By this date, each clinic should receive the 2 iPad, which will equip with the email system and security feature to prevent cyber threat. The MA will begin training on how to use the iPad for triage. Upon the patient arrival, a front clerk will complete the triage in the process efficiently as possible. When check-in complete, the MA will call the patient to the vital sign room to record the height and weight. The patient is escorted to the exam room where the MA completes the remainder of the triage, include documenting and the trip complaint, the vital sign, and other relevant information. After complete the triage, the MA will lead the patient in the exam room to weigh the provider. The total time from calling the patient to complete the triage will be documented in the triage time clock. The study from week 5 to 11 at the same time with the due step. So during each week, the average triage time will be calculated and documented. By the week 11, the SB chart will be generated using the actual data based on the average triage time over 30 days. If more than 5 consecutive points fall below the average, this indicates the process shift and downward trend, demonstrate the iPad quality improvement, and the iPad quality improvement intervention have successfully reduced triage time. If the data point fluctuates randomly around average 10 minutes or higher, this suggests an iPad QI intervention have not resulted in the meaningful improvement in the waiting time. So, at the week 11 and 12, the QI team hold a meeting to review the result, with all major stakeholders include CEO, office manager, facilitator. If the result demonstrates that an iPad reduced the wait time, the clinic announced that the MA should continue using an iPad for the triage process. On the other hand, if the results show no improvement, the QI team will brainstorm, identify any mistake or area where the process did not improve. The PDSA cycle will then repeat with the new idea. Management skill for an iPad for the QI. Although there are barriers, strong management skill can help overcome the obstacle. Communication. The primary method for the communication will be direct email, corresponding among all the team members, supplemented by weekly or semi-monthly meetings to monitor process and address the emerging concern. The application of the social system to the department and the structural level. The medical director and office manager will be review the project overall goal and process. If any critical factor happen, on the stakeholder and knowledge that importance of the quality improvement in activate. Once the budget is permit, allocate the 2 iPad per clinic, the office manager will oversee the overall injury update workflow and ensure the MA receive the proper training. Each clinic will be equipped with the 2 iPads with the designated MA will use to conduct the triage. Eliminating the period. The potential challenge involves the risk of data breach and unauthorized disclosure of patient information. To mitigate this risk, the iPads are equipped with the built-in hardware security operating system, and encrypt capability. Furthermore, in the event of theft or loss, remote data deletion can be activated to safeguard the patient information. Thank you so much for listening to my presentation. If you have any questions, don't hesitate to email me. Thank you so much and have a nice day.